Hello, I am Huang Hua-su. I developed a new treatment called Chims therapy. This method combines Korean acupuncture with body physiology. Chims therapy, which recycles the light generated by the body itself, is a non-drug, non-invasive, and painless treatment. In areas with inflammation and pain, there are reactive oxygen species. These areas emit a weak light, called a biophoton, which is 1/1000th the brightness of a firefly. Chims therapy uses the reflection of these biophotons. By reflecting the weak biophotons from the pain areas, this method creates a mutual resonance with the same wavelength. This allows the weak stimulus to penetrate deeply and stimulate the sensory nerves. The waves emitted from the medical device, such as TENS or razor, do not induce resonance, making it difficult to stimulate sensory nerves. To diagnose for this treatment, you only need to identify the painful areas. You can find the pain by pressing or pinching, and then use the waves emitted from the painful area in reverse. Please refer to the pictures for guidance. This includes methods for diagnosing wrist pain, sinusitis, knee pain, identifying the sternocleidomastoid muscle in MPS, and diagnosing neurological symptoms by pressing the requiring treatments. Let me give you an example of diagnosing neurological symptoms. Press the thoracic cavity vertically with a force of 4 kilograms to feel the bone. Then lightly rub the skin with your fingers to identify the pain area. Be sure to press the entire thoracic cavity front, side, and back, including the whole rib area and sternum. The pain is usually widespread if symptoms are severe. Most people feel pain in the center of the chest due to stress. If you press the center of the chest and don't feel pain, your pressing method might be wrong. This method also applies to other symptoms. If you have numbness in your legs and cannot find a painful spot, it might be a lumbar disc herniation. If you have low back pain but cannot find a painful place, it could be kidney disease. The treatment method involves applying the Chims band, which reflects light using ceramics embedded within Chims band. You can use it in two ways: cut the Chims band to the desired size with scissors, or use pre-cut pieces. The photos show how to treat a dry cough without phlegm, and how to apply the treatment for finger pain. Chims ware applies ceramics to fabric. It is easy to use, can be worn for a long time, and is washable. For dry cough, use the Chims cheek mask. For finger pain, use the Chims glove. Approximately 15 types of Chims ware have been developed, applicable to almost all diseases. Chims ware provides both prevention and treatment at the same time. Understanding the characteristics of Chims therapy through clinical cases published in SCI journals can be very helpful. Here is a clinical case regarding insomnia. The patient is a 46-year-old man who had been unable to sleep without sleeping pills for several years and developed depression a year ago. He experienced palpitations that did not improve with medication. His pulse rate was 80 beats per minute. We applied a CHIMS band to the painful area on his chest, and after 5 minutes, his pulse rate dropped to 60 beats per minute. While the band was applied, the patient reported being able to breathe deeply, and that his palpitations had disappeared. He was instructed to apply the CHIMS band by himself at home. A week later, he returned for a follow-up and reported that the palpitations had disappeared, and that he was able to sleep for about 2 hours. He also mentioned that he felt more than half as less fatigued compared to when he was taking medication to sleep. At the 2-week follow-up, he reported a significant reduction in fatigue and that he woke up feeling clear-headed in the morning. His pulse rate was 67 beats per minute. By the 3rd week, he had stopped taking his medication. 4 weeks later, he reported using the band twice a week. His depression, palpitations, and fatigue had completely disappeared, and he was sleeping for about 6 hours. He mentioned that he was looking for a job. 3 months later, the palpitations had completely disappeared, and his pulse rate was 64 beats per minute. He had found a new job and was working. This case is about treating depression with CHIMS therapy. The patient is a 21-year-old male who came to our clinic right after being discharged from a psychiatric hospital. He was drooling, his head was tilted at a 45-degree angle, and he couldn't walk on his own because his legs were too weak. His eyes had no focus, and he couldn't communicate. According to his guardian, he had trouble concentrating and sleeping since he was about 7 years old and had been taking psychiatric medication frequently. He was diagnosed with depression in middle school and had been hospitalized multiple times each year. His pulse rate was 95 beats per minute. Because he couldn't communicate to identify painful areas on his chest, we applied the CHIMS band across his whole chest. Immediately after applying the band, his pulse rate dropped to 82 beats per minute. When we tried to ask him about his condition, he suddenly started crying. His mother said this was the first time she had seen him cry since his depression diagnosis. We taught his guardian how to apply the CHIMS band at home. A week later, his mother reported that he was sleeping 14 hours a day and looked much clearer than before. Although he seemed to be sleeping excessively, he was not taking any psychiatric medication. A month later, she said he was interacting well with his family and going outside. His pulse rate was 76 beats per minute. Several months later, he was socializing well with his friends and seemed to have no problems with daily life. He hadn't taken any medication since starting CHIMS therapy. In cases of mental illness, improvement is often judged based on the patient's or guardian's statements, which lack objectivity. However, when the CHIMS band is applied to the chest, it causes changes in the pulse rate. For those with mental illnesses, the pulse rate typically changes immediately, usually by 7 to 10 beats per minute. A pulse that is too fast will slow down, and one that is too slow will speed up, returning to the person's normal rate. By continuously monitoring the pulse rate in these clinical cases, we can objectively assess the patient's condition. CHIMS therapy naturally stops once the patient returns to normal. If therapy continues beyond recovery, the patient might sleep excessively or exhibit a change in personality. However, when the patient returns to their pre-illness state, the therapeutic effect stops automatically. CHIMS therapy on the chest can be used for various psychiatric conditions, including depression, insomnia, panic disorder, and ADHD, because it helps restore the balance of neurotransmitters. This case is about treating defecation disorder. The first patient is a 72-year-old man, 170 centimeters tall, and weighing 98 kilograms. His pulse and blood pressure are normal, and he has never been to the hospital for any serious illness. However, he struggles with passing stools, which are large and hard. The stools are so hard that he often has to cut them with scissors to flush them down. He has tried every method for constipation relief without success. When I pressed on his rectus abdominis and oblique muscles, he felt significant pain. So, I applied the CHIMS band to the painful areas. A week later, he returned and reported that his lower abdomen felt very heavy the first day after applying the band, but the discomfort disappeared the next day. 4 days later, his stools were still large but softer, making it easier to pass. Another week later, he was very satisfied, saying his stools were moist enough. When asked about his VAS score, he rated his discomfort from 10 down to 2. The second patient is a 32-year-old woman, 165 centimeters tall, and weighing 74 kilograms. Her blood pressure is 130/80, and her pulse is 72 beats per minute. She always feels bloated, has headaches, and suffers from severe fatigue. Her main issue is chronic constipation, resulting in thin stools. When I tried to insert acupuncture needles into her rectus abdominis and oblique muscles, they wouldn't go in, so I applied the Chims band to her abdomen instead. The next day, she returned and said that as soon as the band was applied, her stomach made a lot of noise, and she had 3 bouts of relieving diarrhea. 2 days later, she was still having 3 comfortable bowel movements a day. Her face looked brighter, and the bloating was gone. A month later, she reported her waist size had reduced from 34 inches to 32 inches, and her fatigue had significantly decreased. 3 months later, she was satisfied with her digestion, headaches, chronic fatigue, and bowel movements, and her weight had decreased from 74 kilograms to 63 kilograms. When asked about her VAS score, she also rated her discomfort from 10 down to 2. To relieve muscle pain caused by tension in the rectus abdominis and oblique muscles, it is necessary to stimulate sensory nerves to activate endorphins. Chims therapy effectively stimulates sensory nerves by reflecting light from the painful area. This activation of endorphins relaxes the rectus abdominis and oblique muscles, leading to the disappearance of abnormal symptoms in the colon. The following is a summary of clinical trial results conducted under the supervision of the Korea Food and Drug Administration. These trials were carried out according to the approval standards for medical devices. Research title is Effects of Chims band for Pain After Shoulder Arthroscopy. This research confirmed that Chims band can relieve shoulder pain caused by various factors. Chims therapy shows that it can treat pain caused by muscle tension, bone pain, and even pain caused by skin tension. Chims therapy can be used with Western techniques like trigger points or tender points, as well as Eastern acupuncture points. It is useful in areas where dry needling, acupuncture, and pain relievers are used, and also with modern physical therapy devices. Combining treatment points allows for the treatment of various conditions. Chims therapy can be applied to interstitial cystitis, fibromyalgia, restless leg syndrome, tics, allergic diseases, and sensory neuropathy. Chims therapy is a non-drug, non-invasive, and painless treatment with no medical accidents. It can be used by pregnant women, infants, and even those with batteries or metal implants in their bodies. Chims provides both prevention and treatment, saving time and money, while improving quality of life. The method is simple, so even people without medical knowledge can treat minor ailments themselves. The treatment effect lasts as long as it is applied and stops automatically once treatment is complete, ensuring no side effects. Simple diagnosis and treatment allow anyone without specialized medical knowledge to treat themselves. The effect is fast, with 6 out of 10 people noticing results within 10 minutes of application. It has received KC certification from the Korea Apparel, Testing, and Research Institute. Numerous SCI papers have been published. and over 100 lectures have been given to Korean doctors. It has been selected as an excellent clinical technology by the Korea Institute of Oriental Medicine, with its safety and efficacy proven in over 3,000 medical institutions. Here are some of the certification materials. The reasons why Chims therapy is needed in the field of treatment. The human body functions through chemical and physical metabolism. Relying solely on chemical treatments often results in no or inadequate treatment options. This therapy, combined with chemical treatment, offers a more complete cure. If you have any questions, please feel free to contact us. Thank you, and you can experience it firsthand by visiting the Korean booth.